Dear students, welcome back. In the previous session, we have discussed about the hip musculature. Now, in this session, we are going to discuss about the muscle function, especially in stance. So, the muscle function in stance can be studied under two categories. One is bilateral stance and unilateral stance. Okay, in the unilateral stance, we can have many types to study. One is compensatory lateral lean of the trunk, okay, and use of a cane ipsilaterally and use of cane contralaterally. And also we are going to discuss about the adjustment of a carried load. Okay, so now in this session we are going to discuss about the bilateral stance. Okay, this is the bilateral stance. So in erect bilateral stance, both hips, okay, are in neutral or slight hyperextension. So here we are discussing about what are the forces acting on the hip joints to maintain in neutral position in bilateral stance. Okay, so here the forces which are acting on the hip joint in the sagittal plane, as well as we are going to discuss about the forces acting on the frontal plane. Now we are going to discuss first in the sagittal plane. So in erect bilateral stance, both hips are in neutral or slight hyperextension. So if the hip joint is in slight hyperextension, then what happens in this position? The LOG, the line of gravity, will fall just behind the hip joint, just behind the hip joint. So the posterior location of the LOG in the sagittal plane creates an extension moment of force around the hip that tends to tilt the pelvis posteriorly. Tilt the pelvis posteriorly. For example, this is anterior and posterior, and here you'll have the pelvis, okay, and here the hip joint. Okay, what will happen? So the LOG falls behind the hip joint, slightly behind the hip joint, which causes slight hyperextension. So this slight hyperextension causes there is a posterior tilting of the pelvis will takes place in the sagittal plane. Okay, then what happens? So this has to be checked. Okay, so the gravitational extension moment, so this one, that LOG means, so this is caused by gravitation, isn't it? The gravitational extension moment is checked by, and this force is checked by opposing. So this force has to check, that means an opposite force is required to maintain again the hip joint in neutral position, isn't it? So for that reason, an opposing passive tension is created in the ligaments, okay, in the ligaments and the joint capsule, okay, so which are taught in full extension. Okay, that means they become very tight, we can call it as, okay, stiff, and this opposing force which helps to maintain the pelvis in the normal position, that means hip is in neutral position, okay, and it is preventing that extension moment. Okay, so actually up to this point we can't see any muscular activity or muscular force is required for the maintenance of this position, isn't it? Only the gravitational force which is causing this posterior tilting of the pelvis, and this one is opposed by the passive tension which is created on the ligaments and the capsule, isn't it? So here a very little muscular activity must be required intermittently, not always required, to maintain AP equilibrium, antero-posterior equilibrium, okay, as long as the LOG remains behind or through the hip, because sometimes what happens, these ligaments and capsules may become to relieve such tension for a longer time, so then the muscle activity is going to help in this position to maintain AP equilibrium. Okay, when LOG, so this is when LOG is fall on the back side of the hip joint, then all these forces and action is taking place. So for example, if LOG is falling on the anterior aspect of the hip joint, it is falling on the anterior aspect of the hip joint, then what happens? So it causes flexion of the hip, okay, it causes flexion moment is created, and then what happens? So again, if the flexion of the hip takes place, that means there is an anterior tilt of the pelvis is taking place. Again, it is not in neutral position. So for this moment is checked by, okay, and this moment is checked by the activity of the extensors, mainly the activity of the hamstrings and gluteus maximus muscles is required to prevent the flexion of hip through anterior tilting of the pelvis and trunk. So these are the forces which are created in sagittal plane during bilateral stance. Okay, now we will move on to the forces which are acting on the frontal plane. So in the frontal plane, so now this peak, the pelvis peak is related to the frontal plane here. So in the frontal plane during bilateral stance, okay, the superimposed body weight or upper body weight. So this is the upper body weight. So head, okay, arms and trunk, all these include the superimposed body weight. Okay, so simply we can call it as HAT. Okay, this weight is transmitted through the sacroiliac joints. Okay, normally the entire weight, we know that. So the center of mass is present on the anterior aspect of S2, body of the S2, isn't it? From there, it is transmitted to the sacroiliac joints, okay, and then to the hip joints. That means the entire upper body weight, it is here, and this weight is divided or transmitted equally on both the hips. Okay, so such equal distribution of weight we can see in a body with normal proportion. So not in obese or very lean persons. So normally proportionate body will have such kind of equal proportionate of weight distribution there. Okay. So now if you consider the weight of the upper body is normally, not considering, so normally the weight of the upper body is always 2/3 of the total body weight, 2/3 of total body weight. Okay, now, so if you consider now if this person only is weighing 180 lb, okay, 180 lb of weight. So then what is the weight of upper body? We have know that 2/3 of the body weight. Okay, so 2/3 of 180, it becomes 120, isn't it? Okay, 3 6, okay, 3 6 are 18. We'll get 2 into 60, that is 120 lb. So now the HAT is 120 lb. Okay, now this weight has to transmit equally on the two hip joints, isn't it? Now, so here this 120 is going to divide equally, okay, that is 60 plus 60, and it is equally distributed to right side hip and left side hip, okay, 60 and 60. So upper body weight is transmitted equally 60 and 60 to the right and left. Okay. So this is the compressive force, isn't it? The weight is the compressive force. Okay. Distributed of 60 lb each between the two supporting hip joints. Okay. Now we will see in this pic. So here the joint axis of each hip lies at an equal distance from the LOG. If you see, this is the LOG, so this is the weight, so this is the LOG, and the joint axis of each hip joint lies equal distance. So that means DR is distance of right hip and DL is distance of left. Okay, that is joint axis of hip joints. So both the distances, right and left, both are same here. That means distances of LOG, the joint axis of each hip, lies at an equal distance from the LOG of what? Upper body weight. Of upper body weight is DR is equal to DL. Okay. So now the body weight on each femoral head, so it is already distributed equally. Then what is the weight, what is the compressive force or weight distributed on right and left? Both are same or not? Yes, both are equally distributed. So weight on the right hip, we can call it as compressive force. Weight on right side or the compressive force which is created by the upper body weight is on right side is equal to the weight distributed on the left hip joint, or the compressive forces which are created by the upper body which is equally transmitted on the hip joint. Both on the left side, both are same. That means weight on right side is equal to weight on left side. Okay, so now, so we have seen the distances, okay, we know the distances, and a compressive force which is acting on the hip joints. So now a force is acting on the joint, and also we know the perpendicular distance. So then on each joint, what is going to create? A torque is created. A torque is created on each joint. So due to this compressive force, what is created? A torque is created. Okay. So and these two torques, however, occur in opposite direction. Why? Because one is the right side and left side. So the torque produced on the left and a torque produced on the right is different directions. Okay, the two torques which are created on the left and the right side, however, occur in opposite direction. So what do you mean by torque? The strength of rotation produced by a force couple. Okay, so here we know the two force couples here, isn't it? One on right side and left side. What is a torque? What is the formula for torque? So it is the product of magnitude of one force and the shortest distance. So we know the shortest distance and one of the forces, that is the compressive force which you are acting. That means then torque is equal to, what is the formula? F into D. We know that D is the shortest distance, or it is the perpendicular distance between the forces. Okay, so now what is the force or torque on right side and left side? So torque on right side is WR into WR into dr. So that is the torque on right side, and WL and DL, which is the torque on left side. But these two torques act on opposite direction. Okay, so if you take any one of the torque, what it is going to do? Okay, yes, now we will see. So the weight of the body, the W for example, acting around at the right hip joint, tends to drop the pelvis on the left. So whatever the compressive forces which are acting on the right side, okay, just imagine that the force which are acting on the right side around the hip joint, so you don't consider on the left, then only this force causes drop of the pelvis on the left side. Okay, if you consider the weight which is acting on the left side, the weight which is acting on the left side will cause us drop on the right side. Okay, so that means the torque which is produced on the right side causes drops on the left side. The torque which is produced on the left side which causes drop on the right side. So then the two opposing gravitational torques of equal magnitude, if you see, both are acting on different directions, but they are having equal opposing gravitational torques, isn't it? For that reason they balance each other. So the forces are balance each other, and to maintain the pelvis in equilibrium without the need of any muscle activity. Okay, again here we didn't get any muscle activity. The forces which are the torques, we can call it as the torques which are created on these opposite sides will help in balancing, will help in maintaining, we can call it maintaining in equilibrium without the need of muscle activity, because the two torques are equal and which is acted on opposite directions. Okay, so here also we are not getting any muscle activity. Okay, only with the upper body weight and the gravitational reaction forces which are creating some torque. So these two forces are balanced, then it is giving stabilization to the pelvis. In which plane? In frontal plane. So we have discussed what are the forces acting on the sagittal plane, and what are the opposing forces which causes in the sagittal plane on the anterior and posterior aspect to maintain AP equilibrium. And also we have discussed the forces, what are the forces acting on the hip joint to maintain the equilibrium of pelvis in frontal plane. Got it? Yes. So if you think when in bilateral stance, is not symmetrical. So this one is the symmetrical stance, but it is not symmetrical. Then what happens? Is all these forces are enough to maintain such kind of equilibrium? No. So then muscle activity is required to either control the motion or to return the hips to symmetrical stance. Okay, if you can see in this pic here, yes. So in this, the pelvis is shifted to right. Okay, the resulting in relative adduction of the right hip and abduction of the left hip. Here you can see such. Here the pelvis is shifted towards the right. So here the pelvis is shifted towards the right. So when it is shifting towards the right, then what is happening here is, so that means on the left side it is it got dropped. Okay, so when it is dropped on the left side, what is happening on the right side means, here you can find a relative abduction. So here the hip is not going to abduction actively because of the shifting of pelvis on the right side. Then what is happening here means, so normally what is the shifting of pelvis on the right side means? So when we stand for a long time, so we can't stand for a long time. So we are shifting some weight to right side for some time and left side for some time, isn't it? So that means if you are shifting weight to right side, both the limbs are in contact with the ground. So when you shifted on to the right side, then what will happen means, here you are not abducting the limbs, just you are shifting onto the right side. What is happening on the left side? We can observe some drop on the pelvis. Okay, and so at that time, how the femur is hip is related to the pelvis means, there is a relative abduction. So relative abduction, that means here the pelvis is coming nearer to the hip joint on the right side, appears to be adducted here. Okay, on the left side, if you can see here, it is moving away. So because of shifting of this pelvis on the right side, you can find there is movement away from the left hip, causing abducted femur on the left side. Okay, so here again it has to come to its neutral position. Then what are the muscles required to work synergistically to get this position into neutral? Means an active contraction of the hip abductors. So why? Because it is in adduction, isn't it? So the contraction of the hip abductors in this way, what is happening? So there is an tilting of this pelvis, isn't it? Okay, and also simultaneous adduction on the adductors work on the left side, make this pelvis into neutral position. So that means in bilateral stance, the contralateral abductors and adductors may function as synergists to control the frontal plane motion of the pelvis. Okay. So although the abductors are commonly credited, so the abductors, so keep it in mind, the abductors, okay, these abductors are commonly credited with serving a stability role. So the hip stability in the frontal plane is mainly done by abductors. So the stabilizing muscles in the hip joint in frontal plane is by abductors. Okay, keep it in mind. So when you are dealing with patients also, if you can see any tiltings during gait or like this in the frontal plane, definitely they will have some weakness in the abductors of the hip. Then you have to train up this abductor muscles to maintain the normal gait. Okay, yes. And although the abductors are given as credited as serving a stability role, whereas these adductors are generally not given such credit. But when the both extremities bear at least of superimposed body weight or upper body weight, the adductors may assist the abductors to control the pelvis against the force of gravity or ground reaction force. In the absence of adequate hip abductor function, then the adductors can contribute to stability in bilateral stances. Okay, so in the case of unilateral stance, the activity of adductor, not abductor, in unilateral stance, the activity of adductors either in the weight bearing or non-weight bearing hip cannot contribute to stability of the stance of limb. In unilateral stance, again in the hip joint, the stability is maintained by the hip joint abductors only. Okay, so we are going to discuss the forces of these abductors in unilateral stance in the next session. Thank you.